Probably the most commonly talked about are sort of environmental reasons. You know, people often say, oh, is it the media that's causing your BDD? You know, because every time we turn on the television or we open a magazine, we keep getting the same message over and over again, namely that appearance is important and you should try to improve it. But frankly, we are all exposed to those messages, and not all of us develop BDD. So researchers have gone further, and they have researched psychological causes for the development of BDD, perhaps being teased in childhood, or having parents that are very focused on appearance themselves, perhaps having parents that have had a plastic surgery themselves, traumatic experiences. And of course, there's also research on families in BDD in order to find out whether there might be perhaps a genetic risk for the development of BDD. In reality, we don't know yet what's causing BDD, and it's quite likely that all of these factors might play a role to a certain degree. Well, some patients have only one body part that they are preoccupied with, but most patients actually have several body parts that they worry about. They might have 3 or 4 body parts. But skin concerns are the most common, followed by hair concerns and nose concerns, but it can really be any part of the body that might be the focus of concern.
We're fortunate to have the medications that we do, and I mentioned the success rate is about 60%. On the other hand, you know, it's a half empty, half full. That's the half full. The half empty is 60% response rate, still leaves 40% of people who aren't responding. So clearly we need to develop new treatments, and that's both pharmacotherapy and behavioral therapy techniques. We're fairly certain that the disorder is associated with some neurotransmitter abnormalities, and the medications that we use help normalize the balance of those neurotransmitters. And with time, you typically see a decrease in the preoccupation with appearance concerns. The medications vary from drugs that are available generically, which are relatively inexpensive, to, of course, some of the newer drugs that are still on patent that are more expensive. So there are available treatments from a medication perspective really across the cost spectrum.